A very good evening to all of you. Hope you know that the topic of discussion, what we are going to discuss about the latest regulation, the draft which is proposed by the nation. So here you can clearly see that the public notice, the draft they have mentioned that we are seeking the comments of the stakeholders on the proposed draft regulations related to national exit test as prescribed in the National Medical Commission 2019 Act. Okay. Yeah, guys, good evening. Learn English with Raj. Yes, I am taking your name. So, in today's discussion, guys, I don't want to explain you vaguely about the draft. So, what we will do is we take all the important points which are there in the draft itself. Therefore, I did not made any kind of a PPT. So, I have directly brought the original draft into this discussion so that we will read the lines and we will see the real meaning into it and what is the proposed guidelines for the foreign medical graduates and also for the Indian medical. Okay. So actually, this document has been sent to all the stakeholders of the NMC, and they have asked their opinions related to the draft what they have proposed, the national exit test part one, or we can say step one as well as step two. So it is just like they want to take few recommendations, and there is a 99.9% of chance that even though we send from various medical colleges whatever may be the recommendations, the final draft is going to be this. So everything whatever we have in this draft is going to be final. Okay. And also majority, yeah, I will explain you all the doubts, guys. So people are asking about December 23. I will explain you everything. Okay. So we will discuss one by one in detail. For first, let me concentrate on the most important points related to the draft. First is the national exit test is applicable to. Okay, so concentrate on these things. National exit test is applicable to everyone who wants to practice in India, whether an Indian citizen who is pursuing their medical education outside India, or an Indian citizen who's pursuing medical education within India in the medical colleges. So all the undergraduate medical student pursuing the degree of MBBS in all the medical colleges as approved by the National Medical Commission, okay, and also all the foreign medical graduates approved by the NM. Means you know, right, all your universities where you are pursuing your MBBS outside India, they must be present in the NMC list. So those who are eligible to apply for the national exit test. Okay. And another very important point they have mentioned at the point number 5. So if you have draft, concentrate on this point number 5, guys. Suddenly they have brought this draft in front of you, and majority of the students, they have already typing, they have a doubt that now by what date this national exit test is going to be implemented. If you read the whole draft, nowhere they have mentioned about the date or the year or the batch. Whether 2018 students who have taken admission in 2018, or who are graduating in 2023, they did not mention anything like that. Means obviously everyone progressively fall into the category of the national exam test. But one of the very important point they have mentioned that if you see on the point number 5, in whenever the next is in force, the corresponding equivalent existing examinations shall be phased out progressively, which means there is a possibility that they might continue with the NEET PG now in March. Obviously, there will be NEET PG, and also there might be a greater chance, 99% of the chance that they will continue the FMG exam twice, even in 2023. But I have discussed with the various senior professors as well as also from the Indian universities, and also spoke to my few colleagues who are already in teaching like NEET PG. They have mentioned that, sir, most probably they are going to start from 20 onwards. That is the reason they have clearly mentioned So about progress, it phased out or ceased to be applicable for the purpose for which the next shall be appropriate. So that may be a chance case, but progressively, whether the student is studying aims or like a foreign medical graduate, whether in Kyrgyzstan or any of the college, or maybe in India, so everyone will fall into a single bucket called as national exit test, and this national exit test will be an exam to get the license to practice medicine in India, and also the same exam, especially the next one score, is going to be applicable to get PG seat in India. So there will be one exam, one nation, one exam. Okay, to take the license to practice medicine as well as to get the PG seat. Okay, for the counseling. So this is the main point we have to take from point number 5. Now, the most important is the chapter 2. They have mentioned about the broad outline, so which is about the general features of the national exit test, right? We know that the national exit test has two separate set of examinations. We call it as steps, like we used to have USMLE step 1 and USMLE step 2, right? USMLE step 1 we used to have basic science, and USMLE step 2, at present there is no CS but CK, clinical knowledge. They used to concentrate on the clinical subjects, but here the pattern is little bit different. If you see the step 1 will be a theoretical exam, right? And also very important thing is the question shall be one or more than one type of multiple choice question. So it will be multiple choice questions, but remember that the main aim of the National Medical Commission is to stop rote learning methodology. Majority of the students, what they are doing is they are studying. Once they finish MBBS, everyone are joining in like coaching for 6 months or most probably for 1 year. They're concentrating more on the rapid revision, they're concentrating more on one liners. So like quick and dirty methods we are following finally to crack NEET PG or crack FMG. So this rote learning methodology is going to go now, because the national exit test will be clinical vignette kind of an exam. So the pattern will be kind of USMLE. Maybe the length of the questions may not be equal to that of USMLE 2, but maybe equal to that of PLAB or maybe Australian Medical Commission, because the question length may be up to 3 to 4 lines or maximum of 5 lines, not like 11, 12 lines like what we see at the present pattern of USMLE, right? So multiple choice question type will be there. It is not compulsory that it will be a single best option or like multiple option will be there. And also the examination shall be delivered online mode on computers. So like what is happening right now with FMG or the NEET PG. Yeah, in FMG, most probably, Dr. Cool, there will be FMG only in December 2023. And most probably, even when we are talking about NEET PG or like INSET or maybe FMG, I hope and I feel that it is going to be implemented from 2024 onwards. Okay, so let us focus here, because it is very very important whether the students at present, you are at first year of MBBS, second year, third year, or whatever it may be, you need to know the pattern of the exam, and it is very important that you need to adopt, because there is no chance, no nothing, we cannot do anything. You have to adapt to the type of pattern of examination, and you have to start preparing right now. So therefore you should know every like small information related to the exam. Also you have to concentrate on this. So the examination shall consist of 6 papers, guys. Concentrate on this. There will be 6 papers. So every day there will be 2 papers, and there will be a 3 days exam. Okay, 6 papers covering subjects of third MBBS, final MBBS for both part 1 and part 2, right? So if you see these 6 medicine and allied disciplines, total 6 subjects for the like next one. Okay, surgery and allied disciplines, obstetrics and gynecology, pediatrics, ENT, opthal. So all these are the subjects. But remember this: applied aspects of all the subjects covered under first and second. In the first year, we will study anatomy, physiology, and biochemistry. And in second year, we are going to study about pathology, pharmacology, and microbiology. Right? So majority of the like till now they were saying that There will be only exams from the clinical aspects, that is from the final year subjects. They will not ask anything from like first and second year. But remember that the subjects of first year and second year are the pillars for the clinicals. If you don't understand anatomy, physiology, biochemistry, pathology, pharmacology, and microbiology properly, how can you apply the basic sciences knowledge to understand the clinical case scenarios? It is absolutely not possible at all. So, it is very important that you need to understand every basic science subject like clinicals. For example, whenever you are studying anatomy, you have to study clinical aspects of anatomy, clinical aspects of physiology, and also clinical aspects of biochemistry. Right now, for example, whenever you study about glycolysis, you might be studying about what is the rate limiting step, what are the irreversible steps, how many like ATPs are produced. So these are the like most commonly asked MCQs. But now they are going to give a case related to the pyruvate kinase deficiency. They will give a case related to the graphs which are associated with the aortic stenosis. They will apply the medicine with the physiology, and they will apply the anatomy with the surgery as well as with the orthopedic. So the clinical aspects which are present in the basic sciences are really, really important. So all the applied aspects of the subjects covered in the first and second year MBBS. So do not take the basic sciences subjects lighter, because if you can't understand the physiology well, if you don't know the cardiac cycle, you can't understand the pharmacology associated with the drugs, you can't understand the internal medicine, and also you can't understand the pathology, you can't understand arrhythmias, right? So therefore, the integration of the knowledge is very, very important. You have to apply the basic sciences knowledge with the clinical subjects, okay? And also applied aspects of all the subjects covered under third MBBS and also final MBBS part 1. So the focus is not on the facts. Facts are anyway important, but how these important facts you are applying in treating the patient, how you are applying your medical knowledge in diagnosing the patient, understanding the patient condition, history, diagnosis, treatment. So how competent you are to treat a particular condition. So that is what NMC wants right now from this. Okay, the NMC wants that every student should think like a, every student should think like a case. Every topic you have to understand like a case. That's why whenever you study one chapter, whether it is in pathology, whether it's in anatomy, you have to solve cases related to individual topics, cases related to individual chapters. Then only you will adapt. Okay, there is aortic regurgitation. How the case will be presented related to aortic regurgitation? What are the buzzwords? So, how I should focus on age? What is the symptomatology? How I should focus on history? All these are important aspects now. So, therefore, concepts are going to be key in passing these national exit test. Okay, so just studying like rapid revision for last couple of months, just by hearting the facts, rote learning methodology is not going to work at all. Okay, yeah. Now, one thing bad news for all the students is till now, like foreign medical graduate exam was conducted twice a year, that was in December as well as in June, but there shall be a regular next step one examination held once a year prior to the university practical examination. I'll also tell you what is the scenario, how the scenario works with the foreign medical graduate as well as with the Indian medical graduate. Generally, the foreign medical graduates are coming to India after taking the degree. And also, the foreign medical graduate has to finish the internship in the respective country where they are pursuing medicine. And once they come back, have already degree in their hand. So once they have the degree, they have to write the next one as well as they have to write the next two, because they don't have any kind of practical examinations like what they used to have for the Indian medical graduates. So scenario is uh, quite different. They just have to sit for the step one as well as for the step two. Everyone, even though Indian medical graduate, they have to write step one as well as they have to sit for the practical examination, which happens in the university for the third year. After that, they have to go for the internship. After that, they have to sit for actual the national exit test too. So practical examinations, whatever which are happening before internship, it is just for the university or medical college point of view. It is not the part of the Next two will be conducted only after the internship. So there will be next one, internship, next two. After that, you will get license to practice. Okay. Yeah. Let's dissect furthermore, because let's see what are all the important points. Okay. So next, there will be, for example, there are total 6 papers we have mentioned, right? I'll also show you what is the pattern of these papers also. For example, if someone fails in 2 papers or 3 papers out of all the 6 papers, there will be a supplementary exam. And most probably supplementary exam will be there in the same year. For example, if you are writing the next one in 2022 December, maybe, 2024 December, for example, most probably they have to conduct supplementary exam within 1 month or something like that to clear those like backlogs whatever you have. So the next one, supplementary examination shall be held once a year, and it is restricted only to the candidates who have failed in one or more of the 6 papers. So it is very, very important that the candidate has to pass all the 6 papers. They will not take all the 6 papers as a cumulative like scoring system. Every paper they will consider individually. Okay. So they have to pass all the 6 papers and are required to repeat those particular papers of the subjects where backlogs are there. So for example, if you have failed in like medicine and allied subjects, it is important only to sit in that paper. There is no need to write all the 6 papers again. Okay. So there will be a supplementary exam also after the normal exam. For example, if a candidate failed in the supplementary exam also, then they have to wait for 1 year. They don't have chance to appear for another exam within 6 months or so. They have to wait 1 year for the regular next one. So they have to sit for that type of exam. Okay. Yeah. And those who do not pass both step 1 regular and the supplementary examination in a particular year shall be able to appear for the next one regular examination only in the following year. I think you got my point here. Now, and it is very important that everyone was saying that, sir, there is only 3 attempts to pass next. Remember, the timeline has given, but there is no limit to the number of attempts. The timeline is you have to pass the next one and next two in a span of 10 years. For example, if you are graduated in like 2023 or 2024, you have around 10 years to like pass these 2 steps, next one as well as next two. So that is what they have mentioned, next one and next two examination within 10 years of joining the MBBS course. Okay. From that time, they are calculating. And also they have clearly mentioned that there is no restriction to the number of attempts to appear in the next one regular examination. But to improve scores in these examinations, they have to take once in a year after the completion of step 2 only. So what is the meaning of? For example, you have passed step 1, but you have got only 53% of score, right? 50% is the pass percent. You have only got 53% of score. So after that, you have finished your internship and you have also passed your step 2, but you want to improve your score because this 53% will not make you to get the PG seat. So therefore, what you will do is only after 1 year, again you will write with the all other fellow mates. You will write the improvement exam once again. That is the next one, because next one score is going to be applicable to get your PG, right? So, for example, in the second attempt, you have got for let us say like 70%. So 70 plus 53, they will consider these 2 scores and they will take the average. Whenever you sit for the counseling, they will see the 2 attempts. So again, you will write for another improvement. For example, in that improvement, you have got around 80%. So they will take last 3 attempts of the next one. So they will take 80% plus 70% plus 56 or 60% divided by 3. So they will take average of last 3 exams or last 2 exams or the last 1 exam. So that is how they will consider. So it is very, very important that whenever you sit for the next one, in the first attempt itself, you need to get maximum score. So it is better you fail in the next one rather than getting 50%. I hope you have understood the logic here, right? For example, if you have failed, there is no problem. Again, you can write next one to directly you can get 70% or 80%. For example, if you have got 50% or 52%, then what will happen? This score will be added for the improvement for the second time, because they are going to take average. In the 2 times, second time also, if you get only 60, in third time if you get 70, and it will become very, very hard for you to get the PG seat. So therefore, the first attempt itself should be a lifesaver for all the students. Okay? So that is what we need to understand from this. Okay, and next step one shall replace the conventional university institutional theory examination for the final year student. So MBBS 3, like, which means MBBS has been right now in India divided into three parts. First year, anat biochem, second year, platform micro, and forensic as well as PSM is also included in this. But the part 3, including all the clinical subjects, right? So next one shall replace the conventional university institutional theory examinations, but this case is not for the foreign medical graduates, because foreign medical graduates are coming with the degree and they will write next one directly, and for them they have to finish their MBBS in their appropriate country as well as in their country, as well as they have to finish the internship, and once they come they have to apply for the next one, and after passing next one these foreign medical graduates has to appear for the internship once again. So two times they have to do the internship. One is in their like country where they are pursuing their MBBS, as well as once again in India after passing national exit test 1. Okay, now next step 2. I hope you have understood what is the step 1. I'll tell you what type of questions are going to come, what is the pattern of the exam. First, let us dissect what is the step 1 as well as step 2 over here. So step 2 will be a practical, clinical and viva voice examination. So I think for majority of the students this will become like chaos, and majority of the students might be worried about this, because many students don't have the hands-on experience, practical experience. But it is very very important that it is the right time from now that you should have the competent skills to perform the tasks. So there will be viva also, and also there will be simulations also covering all these disciplines like medicine, surgery, OBG, peds, ENT, ophthal and orthopedics, including physical medicine and rehabilitation. Okay, and what they will cover, they will cover clinical case based like scenarios, simulated cases, patients aimed at evaluating practical clinical skills, and clinical decision making and communication skills expected from an Indian medical graduate or the foreign like medical graduate to practice modern medicine in India. So you have to concentrate on this. So what type of clinical based questions, simulations, competencies, what they are going to ask? Guys, go to Google and type CBME curriculum. So majority of the students are asking what will be the pattern for the national exam. So what is the syllabus for the national exam? Syllabus for the national exit test is nothing but the current CBME curriculum, which is already there in the site. Just go to Google and type UG Med CBME curriculum. You will get like volume 1, volume 2 and volume 3 in the website itself. If you click, the separate window will open with the PDFs, and from there you can see what are all the competencies they are talking about, because the curriculum itself says that it is a competency based medical education. So how the student is competent enough to diagnose, to treat a patient. So that is called as CBME curriculum. So we have to know this is the pattern of step 2. Okay, and same thing, there shall be regular step 2 examination once a year, same like step 1, and step 2 supplementary examination shall be held once a year and is restricted only to those candidates who have failed in one or more subjects of the 7 subjects which I have mentioned here. Okay, same here. So you have to pass every exam in the next one, and every paper in the next one, and even in the practicals also in the step 2 also you have to pass every subject in the next two. Out of 7 subjects you have to pass every subject. For example, you have failed maybe in pediatrics as well as in ENT, you have to sit for those 2 exams, maybe in the supplementary, and even if you fail in the supplementary you have to sit for the next year. Same, the pattern will be same as like next one. So those who do not pass both next 2 regular as well as supplementary examination, they have to appear the next 2 only in the following year. They have to wait for 1 year. So this is where there is some kind of a pain, because we have to wait for 1 whole year, and we don't have any chance like what we have in the FMG to appear for like twice a year, right? Yeah. And also same thing like next one, there is no restriction to the number of attempts to appear in next two, right? So that is very important now. Now coming about what is the nature of scoring. So when we talk about nature of scoring and minimum scores for passing, guys, 50% is the like passing grades over here, which means in the next one you need to get 50% in each and every paper. For example, if you have 6 papers, you need to get 50% in each paper. For example, in 6 papers you have in 5 papers you have got 80%. In one paper you have got 30%, which means you have failed in that one paper. It is not the cumulative score. They are calculating and they are taking individual paper as a reference. Okay, so the 50% for individual, so 50 out of 100. Okay, so and also for the next step one, in each of the 6 papers it is clearly mentioned that 50% you have to score, guys. Okay, now what about step 2 here? Next two is just pass and fail exam. So the what we can say, the senior or the professor who is like checking your skills, your competencies, so completely it is in his hands. So he will write based on your competencies, based on your skills, based on your communication, your ability to tackle the case. So he will write pass and fail. So there are no grades in that. Same like what we used to have in your assembly step 2 CS. Right now it is not there, but it was like pass and fail exam. You'll just know that I have passed in these three and I've failed in these. So that is just a pass and fail exam. Okay, after the satisfactory demonstration having acquired the competence. To know what competencies you need to know for each and every subject, check the latest CBME curriculum. In that they have mentioned everything. Okay, yeah. And also uh, other points are not that important. Let's directly go to yes. Objectives of step 1, we have already mentioned that it will be an MCQ point. Now see guys, if you remember, I have made one video on national exit test exactly 1 year ago. At that time I have clearly mentioned that in the national exit test it is going to be case based clinical vignette kind of questions, and right now the pattern of NEET PG and the pattern of FMG, the type of questions what they are going to ask, is going to be completely nullified. I've told that, but majority of the colleagues and professors also did not agree with me that there will not be sudden change like that, because the students are not adapted to understand the clinical scenarios. These days everyone are learning about the facts, like what is the most common cause of atrial fibrillation. So in atrial fibrillation, P wave absent in. So this is how they are like just by hearting, they're mugging up. But whenever they have mentioned about competency based itself, I have read the complete document, like hundreds of pages of documents, in that the goal they have mentioned very clearly that it is going to be a clinical vignette. So that is what they have mentioned right now in the draft very clearly. You can see here 65% are clinical tests. So now if you are starting your preparation with anatomy, biology or biochemistry, start practicing with the cases related to each and every chapter and each topic. Facts are important, because if you don't know the facts you cannot understand the case. So facts are important. For example, if you are studying about glycogen storage diseases, there is no need for us to remember the entire like cycle, important enzymes which are important, which are associated with the diseases. Previously they just used to ask what is the like enzyme deficiency, what is the disease, but now they are going to give a clinical case related to the disease. So you should know that how Gaucher disease is going to be asked and how tetralogy of Fallot is going to be asked. So you should know that how the case is presented, what are the different ways the case is presented, how to find out the clues, and what are the buzzwords which are present. So this is what is very, very important, guys. Okay. So 65% are clinical vignettes here, which are problem solving and analytical skill types. And 25% is comprehension. Like they will give a kind of a story, like paragraph, maybe a paragraph kind of a like questions will be there, 25%. So literally both are considered to be same. Recall is only 10%. Like fact based. Fact based is only 10%, which means 90% is going to be the comprehension type as well as the problem solving type, which are the clinical vignettes. So therefore every student has to know the case vignettes and clinical case scenarios. I'm repeating once again, case vignettes and clinical case scenarios. This is what I was explaining like previously also, even to all of my universities are associated with us. Okay, and you can see this level of knowledge also, guys. There are like rarest conditions and diseases, rarest treatment options, right? Even this was there, and there were like most common. So it is very important that as a doctor, everyone should know what is the most common drug which is used, what is the most common diagnosis, what is the initial diagnosis, what is the diagnosis of choice. So all these things we should know. So must know should be 60% in the exam. What they're going to ask, nice to know is 90%. Means important information which is required, which is most common, 90% they are going to ask in the exam. And may know, which means rare conditions. Sometimes we may not use the drug at all, but they are asking about the exam. Maybe 1 in 10,000 or 1 in 100,000 patients this disease is present. For example, when we are talking about like any kind of a rare condition, so it comes under like may know. So therefore you have to concentrate on applying the clinical vignettes on two important aspects, that is must know and nice to know. Okay? Yeah, and you can see here these are the six papers, and you can see the medicine and allied subjects will be 120 items, surgery and allied subjects will be 120 items. 120 items is nothing but 120 questions or clinical scenarios, we can say. And pediatrics, ENT and ophthalmology will be 60. So there are totally six papers divided into 3 days. You can see on day one you have medicine and allied subjects in the morning session, which will be of 3 hours, and there will be a break of 2 hours. And in the afternoon session there will be a pediatric exam, it will be of 1.5 hour. So 3 hours exam in the morning and 1.5 hour exam in the like afternoon, with a break of 2 hours in the middle. And next day there will be a rest day. You can see there is no examination. And after rest day there will be surgery and allied subjects with ENT. Again there is a rest day, no examination, and OBG plus ophthalmology. So there will be a 3 days exam. Totally there will be 540 MCQs they are going to ask in all these six paper, guys. Okay, yeah. So this is very very important now for us to know. And information regarding step 2, if you see, they have clearly mentioned it over here that patient and clinical decision making, practical and communication skills necessary for the practice of modern system of medicine, especially in India, right? So that is what they have mentioned. Okay, so yeah, passed out students also I will mention. I will mention, don't worry about it. Okay, first let me finish this document. Almost we are about to finish this. Okay, and you can see the distribution of the subjects which are present in this step 2 also, we can see here. So these are the subjects what they are going to ask for step 2, that is for the practical skills and all, right? Yeah, at last they did not mention, they have mentioned about second week of December, next one regular will be there, and second week of January, date of result and completion, everything they have mentioned. But the big question is from when, it is from 2023 or it is from, they did not mention from which batch they are going to apply. But we don't know, maybe 2018 or 19, we don't know. But 100% there is a chance that from 2024 onwards, slowly they will continue for one batch, they will continue, that is March, they will continue PG, and the NEET PG will fade out, and next will come into picture most probably for. And also for the foreign medical graduates, maybe they'll give relaxation for like June as well as for the December batch. After that, again they will also fall under this. Maybe for 1 year or 2 years, they may run FMG as well as this national exit test simultaneously along with the NEET PG. But we don't know, we have to wait for those final guidelines. But whatever it may be, it is important that we have to be prepared for the national exit test, right? So that's why, therefore, I want to tell all of you that at least from now, stop thinking about you will study all these 19 subjects within a span of 6 months. If I just sit for 3 hours and finish entire internal for the quick revision, maybe it will be helpful for you to pass this January exam as well as after the June exam, maybe after the December exam, but it is not going to help you if you want to sit for the national future. So The only thing which will save your life as a student, you are a final year student or first and second, is important that you need to understand concepts. Only when you understand the concepts, you are in a position to apply the conceptual knowledge to understand the clues what they are giving in clinical scenarios. And also, whenever you are studying clinicals, you can understand clinicals only when basics are really strong. So don't even fall into the trap that first and second year subjects are not important. I will directly start reading from ENT, ophthalmology, internal medicine is not going to work. And I told you that if you get 52% in the step one, it is going to haunt you, because this score is going to add you whenever they are taking like percentage, right? They are taking whenever again you when you are writing improvement, even if you get 80 also, this 50 or 53 what you have got in the next one, they will add both, and there will be score of 130 divided by 2, your percentage still it is only even after the. Therefore, whenever you are writing for the national exit one, it is really important that you have to be well equipped with the knowledge. What type of knowledge? Theoretical knowledge, conceptual knowledge. It is not the knowledge like just like sawtooth p waves are present in atrial flutter, but suddenly if I ask you what exactly the atrial flutter, nobody knows it. So majority of the students, even like till today also, sir, do you have one liners for biochem? Do you have one liners for ENT? I want like only 5 pages, entire biochemistry is covered. We can't do this. It is not going to work, right? So I hope, and also I will make a separate video for detailed syllabus, and I'll also make a separate video how to solve cases for individual subject chapter as well as for the topic also, and we will discuss in detail about the CBME curriculum, because we have to take a separate session to understand completely about the syllabus and portion as per the latest competency based medical education. So if you have any doubts, you can like ask me, okay, via my Telegram or via my like Instagram. So I majority of the cases I do reply for majority of the students. Almost I reply to everyone. Maybe may delay for like couple of hours if I'm busy, but my like core thing is like I will respond to most of the message. Okay. So this is the latest guidelines, guys. So I hope everyone have understood it really well, and thank you so much for joining us. Take care. See you again on next class.